welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. Today, we're going to be talking about depression. Every time we meet, we talk about another little subject that could be helpful for you or maybe somebody you know on your journey towards optimum health. So we're talking about depression today, and I have Sara Dockstader with me from Bayshore Counseling. Thank you for being here.
Of course, I'm glad to be.
Yeah. And we were talking before the camera started rolling about this topic and how it's really depression. It's really quite common-ish, at least my guess is. But talk a little bit about what depression is officially.
There's lots of definitions out there. I think the most important thing for people to recognize is that it's more than just feeling sad. Typically, for depression as a diagnosis, it is ongoing. Okay. It will impact regular interests. So if somebody loves to do basketball and all of a sudden they don't have any interest in going into practice, or if they're really interested in music or hanging out with their friends and all of a sudden they don't want to do that anymore, and we see that go on, that can be a really red flag for depression. So I think it's really important to know that we all have sad feelings and we all go through experiences that can cause us to feel incredibly sad. Depression is when it continues and it's ongoing and a loss of interest happens.
Okay, so a little bit different than just down in the dumps. Or can it be brought on by like an event, like a loss of a job, or
yeah, absolutely,
3 months of cold, dreary weather, or that kind of
or
stuff?
Or a pandemic? Yes, sure. Absolutely. I think there's a couple different things that can impact depression or bring it on. One, we are seeing a genetic component. Okay. So if there is mental health difficulties in your family, you may be more susceptible. And then absolutely when there is a trauma or a really difficult time, a loss, a divorce, an illness, job loss, the change in life that we've all experienced can definitely trigger on depression. So it's important to pay attention to those things. If you're not starting to feel better, if you're not learning to cope in a new way, probably letting you know that you might need to reach out.
And you mentioned the genetic component, that you might be a little more predisposed to it. Does that mean you will have depression or you will have anxiety?
Not necessarily. I think it's, and they're still doing a lot of research on that. I think it's important to be mindful of it if it's in your family, but don't self-diagnose, don't assume. Gotcha. Because everybody's body makeup is different. So it's just something to, if you're starting to feel like, okay, this isn't getting better, and you know that people struggle with it in your family, that those two things together can kind of make you struggle a bit more.
Okay. So, I mean, kind of like diabetes or
right.
something else.
Right.
It doesn't mean you're going to have it, but just to pay, know that, pay attention
exactly.
to it.
Exactly.
Kind of okay. So it's different than down in the dumps. It lasts a little bit longer. There is a genetic component to it. What can somebody do who is like, this has been hanging on for a while? What can somebody do when they feel that way? Or when they know somebody who's kind of been feeling that way or acting? I
think that's such a good question, because I think no matter how much we talk about mental health, there still really is a stigma out there. We don't recognize that our mental health is so important to our overall health. We often hear people talk about being physically fit, losing weight, those kind of things, but we don't talk about how do we improve our mental health. So I think it's such an important question. What was the question though?
What do you do when you...
Okay, when it's hanging on.
Yep.
So I think talking is the first thing, which can be hard. I think if you're a parent and you're recognizing signs in your child, it's really important to have those conversations with them. If you notice it in yourself, finding a trusted person you can talk to that might help you, guide you. Okay. I mean, obviously I'm a big proponent for getting some support through therapy or counseling. I think that is so beneficial. And if you have a friend, being a good listener, but sometimes you have to go beyond listening. So if you have a friend that's really struggling, and I see this especially in young people, they don't want to betray their friend's confidence. So if their friend says, please don't tell anyone, I'm really struggling, I always encourage young people to say, I care about you too much to keep this to myself because I think you need to get some support, or however they want to talk about it. Because sometimes we need to be supported and we aren't willing to take that first step.
And you're right, it is, there is, even after all this time, And all the people who have, I'm sure when you sit in a room with somebody, there's probably a good deal of people in there who have spoken with a counselor or have gone through some kind of treatment or something like that. But there still is a little bit of a stigma. When we've talked about the topic before, we try to say, if you had diabetes or if you had high blood pressure, you wouldn't just keep it in and not necessarily do something about it if there's a way to help it. But it's just a matter of somebody kind of has to take that step or have a friend help them take that step to see that
it's okay.
It's not.
One of the things I've noticed is that when you talk about it or when you share and you're vulnerable and you say, I've struggled, I've had anxiety my entire life. I remember as a teen really struggling with that and not knowing what it was. When you start to talk about it, what you realize is you're not the only one. I've sat at a lot of different even high schools where they've done discussions on mental health, and you'll see the kids realize I'm not just the only one that feels this way. So I do think that conversation piece is really important, but it does require bravery. I mean, we do still live in a world that thinks you should figure it out, or they'll say, you don't have any reason to be depressed, or you're just being, a lot of times with youth I hear words like they're being dramatic, they're overreacting, it's not that big of a deal. And those are all well intended. We don't want to think our youth are struggling, but it does a disservice to people who are trying to talk about it and get support. So I think being a good listener and having those conversations is huge to dispelling that myth.
And you're right, I have had, just sitting around talking with friends or whatever, and I think I'm dealing with this, and you're not the, lo and behold,
you're not the only
one.
No.
So somebody needs, again, to have that little bit of bravery and say, I think I got something going on here.
Yep.
It doesn't necessarily have to be a mammoth issue, but like you said, if it's just ongoing and it's kind of impacting your daily habits or choices or whatever.
And you don't have to feel that way. I think sometimes we think that pain and that sadness won't end, and it can be a journey, but you're not going to have to live like that forever. And if you reach out and get really good support, it can be life-changing for people.
Yeah. And so what is I suppose one of the concerns is if you do have depression and you maybe are, not reaching out or to friends or counseling or whatever, do people then cope with it in different ways? And that's where we get other issues then compounding it.
Yeah, if working in the field that I work in, one of the things we see a lot is something called dual diagnosis. So people truly that have mental health struggles often will also have addiction issues of different kinds. So we see those two things go hand in hand. There's a lot of research out there now. Most people hear about trauma. So we're recognizing that when people experience trauma, that can impact the likelihood of having difficulty with their mental health, especially if that happens in the early years of development. So those definitely can go hand to hand, and then it's about coping in unhealthy ways instead of healthy ways.
So if we're not handling or addressing depression, and there's different ways people cope with it then, and some of them aren't so healthy. So what we want to do basically is recognize it and do something about it. So how does somebody go about seeking out counseling? What is it like when you go see a counselor?
I think the first thing that's really important is to let people know that no matter where you go to counseling at, whether you go to an agency or to a private office, that it does take time to get into counseling.
Sure.
So don't wait until you are in crisis situation.
Sure.
Because a lot of times I will see that happen. People will wait until it's so bad, and then they have to wait 2 weeks to get in, and now they're really struggling. So I kind of look at counseling almost like a vitamin, like getting in and doing the things that you can do to keep yourself from getting to that place. So it's a process. Usually you can talk to someone who may know some examples. I know you're going to give some examples where people can call and go.
Right.
People set it up. You go in. The first time, typically, they just take some information from you.
Yeah.
You sign some papers, and then after that, they typically meet once a week. It's confidential, so it stays between you and the therapist. And the only time a therapist ever has to disclose anything is if they're truly worried about your safety and well-being. I also tell people that a relationship with a therapist is just like any other relationship. You may find a therapist and go to them for a period of time and feel like you just don't have that connection and you can't really be open and honest. And a good therapist understands that, does not take that personally. So be willing to kind of try another therapist if that first experience isn't exactly what you need.
Okay. Yeah.
I think it's really important for people to know that that is totally okay, and quality therapists understand that. And so that's kind of the process. And it's also important to know that therapy is not a fix. You have to engage in therapy. You have to do your part.
Right.
So you will be given tools, and they will help you talk through difficult things, and they will give you suggestions. But at the end of the day, you have to put those tools in place.
Right.
So it becomes kind of a partnership, and you control how that partnership is going to go. But I definitely think it can make a big impact on people's lives.
Sure. It's just a matter of catching things, doing something about it before it gets to a crisis point, certainly, and then just kind of doing the little bit of work for it and kind of sticking through it. So.
And I think people are always surprised at how just talking to an unbiased person makes them feel. As a mom, you love your kids, you want to support them, but it's very difficult to be objective with your own children.
Sure.
Sometimes you need someone else who is not involved to be able to give that insight. So I think it really has its benefits if it's utilized.
Sure. So there's lots of resources out there. We have, and we'll put them up on the screen, and for people to reach out to, because that's kind of the bottom line. Is it's really quite common. You had a statistic that kids one
out of five will experience depression before the age of 25. So that shows you right there that you're not alone.
Absolutely,
you're not alone.
It's very common. There is still probably a stigma about it, but I don't really know that there should be or needs to be, for goodness sakes. And so we're kind of giving them a couple little tools here to do something about it.
Yep.
Awesome. Thank you very much.
No problem. Thanks for having me.
As always, I hope this topic was interesting, shared some useful information, either for you or somebody you know and love. You're always going to want to include your healthcare provider in on any plans or conversations if you're changing anything, but I don't think this was anything that probably your primary care provider would be concerned about, but I always have to put that disclaimer in there. So thank you for being here.
Thank you.
Take the information and use it, and until we meet again, I encourage you to make time for health.